So we've survived a year, but hopefully it won't be too long before we can meet in person again and I can see your faces, which is always lovely. Tonight, I'm going to go through naturopathic support for seasonal allergies and other, because it does include cats and dogs, dust and molds, but really kind of focusing on the fact that spring has sprung in BC, the pollens are out, and I'm already hearing some murmurs of complaint at the playground of, oh my goodness, I can feel it in my eyes, I can feel it up my nose, and what can I do about this? And every year I want to help as many allergy sufferers as I can. So I am Dr. Wiley. We'll start there. A little about me. I'm an eternal student. I'm very, very bad at saying I don't know, so I can go as far as I don't know yet. And so I just keep learning as much as I can. I am the mother of two very small people. One is 2.5, one is 6.5. And so that eternal student is a lot of learning about parenting too, which is fun and exciting. And I'm a whole food foodie. My first degree is in nutrition. I grew up asking questions about what purple food does inside my body, like grapes or eggplant, versus what does green food do inside my body. And my parents didn't know, so they would just buy me books. And that got me on my journey. I started in a health food store when I was 13 years old. It was just a summer job to get out of the house. And that made me decide by 14 years old, I knew I was going to do naturopathic medicine. I feel incredibly lucky that I was able to come up with my vocation so early. So it really is like everything I know. I'm an inch wide and a mile deep. This is my one area. I don't know how my car works, barely know how my phone works, but medicine and food and nutrition and health, this is what I love. Today, we're going to do a brief overview of the immune system and the allergic response so that we're all on the same page with understanding what's happening when I'm talking about allergies. An overview of naturopathic medicine. Some of you might be new to this type of medicine, and so I'd like to explain how we work and where we come from, and obviously relate that back to allergies, and then go through some naturopathic options for allergy sufferers. And I'm very vague there. I don't give specific doses because when we're talking about allergy, we might be talking about itchy eyes, we might be talking about stuffed nose, we might be talking about hives or eczema, it might be asthma. So that's where the medicine gets much more individualized. So overall, looking at that immune system. So the immune system is our chief line of defense against anything that threatens our health and longevity. A balanced immune system, it's, I almost put up a picture of scales just to talk about how we really need it to be in balance. We don't want it too high, we don't want it too low. If our immune system is underactive, we're going to focus on the bottom of the screen here, then we'll see diseases like cancer. Our cells are replicating all the time. It makes mistake. The immune system catches those mistakes, get rid of that cell, tumors are prevented. When we have an underactive immune system, things can slip through the cracks and we can end up with some problems. There are some viruses that, if our immune system isn't there, can flare up or be long-term and difficult for our immune system to get rid of. So we'll see shingles, HIV, tuberculosis, herpes. Your immune system slumps down, you get the cold sore, the lesions, the outbreaks. Or if the threat is external in that green box, that's the person who's catching every cold that goes around or has athlete's foot that they can't get on top of, or intestinal parasites or whatever is bugging them. Their immune system is not strong enough to mount a sufficient response to get rid of that infectious agent and bring us back to health and normality. But we don't want to just boost the immune system willy-nilly. We need to be mindful of the fact that it can overreact as well. And if that threat then is internal, that's when we start seeing autoimmune conditions, when the immune system is attacking the thyroid, the joints, the digestive tract, the pancreas, whatever it may be. We don't want that. We want to have a nice, powerful immune system with inflammation control and modulation, find that balance. And then the external threat with that overactive immune system is where we're going to be focusing tonight. That's when we're in this world of allergic response. And that can be a reaction to food, it can be a reaction to the outside environment, to metals, to whatever it is that irritates our system and our immune system freaks out about. And it can manifest as like hay fever or allergic rhinitis, asthma, hives, eczema. And there can be sort of a number of issues. And obviously that's where we're going to be focusing our time and attention this evening. So the allergic response pathway, this is going to be nice and simple, partly just to give an overview and partly because of my skill at drawing these type of animations on PowerPoint. So we first have an antigen that comes in. So an antigen could be an allergen. This could be a pollen. This could be cat dander. This could be a metal. This could be a food particle. And it goes in and it comes into contact with a B cell, which is one of the types of cells in our immune system. So it's a white blood cell. And when that antigen connects with the B cell, an antigen in this could also theoretically be, a virus or something. The B cell gets exposed and then it differentiates. It changes and it becomes a plasma cell. It's got its piece of information. Now it's going to respond and react to that. And the way that it does that, convert into a plasma cell and start producing antibodies. So these are generally Y-shaped things, but I can't make a Y. Out come the antibodies. And then an antibody will connect to a mast cell. Mast cells are cells that lie in our skin, in our bronchial tree, along our digestive tract, sort of generally external parts of the body. And once that cell has been sensitized by an antibody, hey, we've seen something negative, here's a marker so you can recognize it in the future, attach that onto the mast cell. The next time we then get exposed to that antigen, the bee sting, the pollen, the following spring, that comes in, that attaches to that sensitized mast cell, and then we have this histamine release. And histamine is a very understandable word when we're talking about allergies. It's the target of most medicines related to allergy treatment. So histamine is our main target. It is a vasoactive amine. So it is something that goes out, it's released from the mast cells, and it goes through and it changes that local environment in order to protect us. So an allergic response is that exaggerated immune system saying, pollen, oh, we need to shut this down. Shellfish, oh no, let's close the throat and protect the system, which obviously can backfire hugely. So we get this dilation of blood vessels. So often, we'll see that swelling, whether that's in the sinuses or the throat or on the skin with a hive starting up. We'll see flushing. People start to feel red and hot. And then because all that blood is dilating out, the blood pressure drops, and that's when we run the risk of anaphylaxis. So, blood pressure is gone, and then we hit a life-threatening situation. Usually not the case with seasonal allergies. That is more a food allergy situation. But still, we've got that sort of slight lowering of blood pressure. It can constrict bronchial tissue. So we talk about the asthmatic response to allergens, that difficulty breathing in. And it also increases stomach acid production. So some antacid medications target histamine as well. Antihistamines are the classic med for treating allergies. And their job is to, histamine's floating around. It's going to go find a cell on the blood vessel and encourage it to dilate. It blocks that receptor. The histamine cannot bind to that receptor. Therefore, the signal doesn't get passed on. It's effective. The downside is it's, what's the expression? You're closing the gate after the horse is bolted. The histamine is already in the bloodstream, and you can stop it binding to receptors in the system. But if we can go farther upstream and stop or slow the release of histamine in the first place, then we're ahead of the game. We're going to be doing a whole lot better. So now we'll come into the 6 principles of naturopathic medicine. We learn this, I think, within the first week or the first month of school. We memorize it. It comes back to us every time we learn something new, and it should guide our treatment and how we work as naturopathic physicians. The first principle is to first do no harm. That is pretty universal, I think, across all medical professions. Don't make your patient worse. We focus on the healing power of nature, which can be twofold. On the one hand, we do use a lot of herbs and plants and nutrition and nutraceuticals, but also there is in naturopathic medicine an inherent belief that the body is capable of healing itself. If we give what is lacking, if we take away what is impairing the function, the cells, the tissues, the organs can return to normal function. So we're working on the healing power of our own nature. Treating the whole person. Someone might have palpitations, and that could be a cardiovascular issue, but it might be a thyroid issue, a hormone issue. It might be due to anxiety or stress, and they're just manifesting it in their heart. So we want to treat that whole person and look at the connections between what's going on with the hormone system and the nervous system and the digestive tract and all of those parts. Treating the root cause. So it's amazing to me still how many times a patient will come in and they'll list, I've got 4 symptoms. This is bugging me, that's bugging me, this is bugging me, that's bugging me. And all of those really can sort of whittle down to 1 or 2 areas where we need to focus. And then the 4 things can be sort of commonly resolved or improved. So finding out why. If someone has, anemia, they're low iron, we can give them iron, but why are they low iron? Are they not eating enough? Are they not absorbing it? Are they excreting too much? So constantly finding why, which works well for me because I love asking questions and, again, that eternal student thing. Doctor as teacher is one of our principles. So it's not for me to say you should do this without explaining why. My job is to educate people on their bodies, how their bodies work, guide them to make the right decisions, but ultimately eating more vegetables, drinking more water, getting more sleep, that's up to the patient. But we can explain why it's important and how our system works. And then prevention. So we've heard that an ounce of prevention is worth a pound of cure. 100% agree with that. If I do my job properly and see enough people, there should be less impact on the hospitals, right? We can prevent diabetes, we can prevent cardiovascular disease. So obviously this time we'll be talking about how to prevent allergies and allergy symptoms. So first, do no harm, as I said, pretty basic tenet of all medicine fields. So we want to choose the modality or the treatment that will offer the most benefit with the fewest side effects. Antihistamines work, absolutely. They will, drop that allergic response, but they can cause drowsiness and therefore might be great if your job is working a forklift or, needing to be sharp communication with other people. So we want to use them as needed, but if there's a way we can prevent them and minimize those side effects, all the better. The healing power of nature. So I'll just do a quick overview of some of the herbs and nutrients that will often be used. If someone comes in like right now today, the pollens are out, the histamine is rampant, what can I do for my allergy symptoms right now? We might talk about vitamin C. Are they taking some? What dose? What form? And vitamin C has been shown to be a good antihistamine. The bioflavonoids. These are compounds that are often complexed with vitamin C in foods. So again, whole food rather than isolates will give us more benefit. Quercetin has the most research behind it as an anti-allergenic agent, but rutin and asparagine also do as well. So getting everything that's found within the orange, the red pepper, the grapes, the high vitamin C foods. Vitamin D is a great immunomodulator. So if your immune system is too active, autoimmune disease, allergies, it can help to normalize it. If your immune system is underactive, it can help to boost it, but it doesn't push things too far one way or the other. Dosing varies with the season, with the individual, with their diet, with their digestion, with their skin color. So there's a number of ways to determine dosing there. Omega-3 fatty acids, lots of research on its anti-allergenic potential, right down to pregnant women who are getting ample stores or ample intake of omega-3 fatty acids tend to have less allergenic children, both in that first year and measured up to, I think, 6 years old. The kids displayed less allergy symptoms when they get omega-3 in their diet, and if it even started prenatally when they were still inside mama. Herbs might be something like nettle leaf, which doesn't taste bad. It's nutrient rich, but it has some anti-allergenic properties in it. If you think about getting stung by fresh nettle, which is starting to come up, you get that histamine response. So the nettle leaf seems to act as almost a homeopathic in a way, just by bringing that little bit of response, it tells our immune system to calm down. Eyebright is another wonderful herb that can be drunk as a tea that helps a lot with allergic rhinitis symptoms, so the watery eyes, the runny nose, or the congestion. Bifidobacteria, so a particular subset of our probiotic allies. So some bacteria increase histamine levels, some bacteria help to break them down. Bifido helps to break it down. And then there's many, many others. And as I said, I'm very clear in my mind if I don't want to give doses here because I don't know you. I don't know that patient. I don't know what they're already on or how they're experiencing their allergies and how it's manifesting. But just to know there are lots of options available to help normalize that immune system and bring in the healing power of nature so that your body can heal and respond. Treating the whole person. So with allergy management essentially being immune modulation, we have an overactive arm of the immune system that is saying that pollens are dangerous. We need to flush everything out and shut everything down and have swelling and itching and it's too reactive. If we want to normalize that immune system, we have to look at everything else that's going on with that individual. And that will include the digestive tract. I had one patient who came in a couple of years ago because he woke up every morning, sneezed repeatedly, and then, was okay for the rest of the day. And so we did some allergy treatments on him, but he also had some digestive issues going on. It wasn't his chief focus. It was the sneezing. We started doing stuff. He improved a bit. Follow-up visits a little later. I'm like, I think we need to start adjusting the digestion. As we did that, I'm no longer sneezing in the morning. So the allergy treatment made some progress, but it wasn't until we brought in the digestive piece that he really, really started to improve. The nervous system ties in with the immune system, as does hormone balance. So if we're under stress, our immune system tends to deplete or react in inappropriate ways. So sometimes we just need to calm the system down, ensure there's enough sleep, there's balance, there's play, and modulate that so that we get that communication between the nerves and the immune system settling down. Hormone balance, this can be anything from blood sugar, thyroid, sex hormones, and any imbalance within our endocrine system can have a negative impact on our immune function as well. And then diet and nutrition. Can't get away from diet and nutrition. So sometimes we need to take away foods that are high in histamine or that trigger a histamine release, even in a healthy non-allergic individual. Bring in things like the omega-3s, more whole foods, more bioflavonoids, more antioxidants, and helping to normalize the immune system that way. Treating the whole person. Treating the root cause. So this is where I'm gonna spend the most time really is on this allergy immunotherapy. So immunotherapy, it's immune therapy, and its target is to retrain the immune system so that it accepts antigens and doesn't see them as threats. So essentially it's bringing in a very low level of the allergen, of the antigen, at sort of a level that the immune system isn't going to respond to. It's a little bit of white noise. I don't really care. I'm not going to freak out about that. It's there. And over time, that level can build up. The immune system just kind of gets used to seeing it around and knowing that it's not a big deal and I don't need to freak out. And then desensitization happens. This takes time. This generally takes several years, 3 to 5 years. The classic one, the oldest way and the most researched way are allergy shots. So someone goes in, they get scratch testing, they're allergic to birch trees, and then they start going in weekly to their doctor's office, getting an allergy shot with a very, very low level of that birch tree pollen, a diluted level, and it goes into the system. And then a week later, another shot. So allergy shots are effective. The problem is not everyone wants to get needles, so it's not a great therapy for kids or some adults. You have to take time out of your schedule. You have to book appointments. You have to, there's a lot more effort involved, but it is well researched. There is also some risk of anaphylaxis. So immunotherapy, you do it in a doctor's office with access to all the first aid equipment. But either way, it takes time when we're looking at the injection route. An alternative, which is more widely used in Europe, it is somewhat used in the States. In Canada, I think it's only on label for grass and off label for everything else, which then makes it entirely sort of the realm of naturopathic doctors because we have access to it. It is prescription, is sublingual immunotherapy. So it's still that very, very low dose allergen, starting generally with a 1 in 1,000 dilution. For some people who are really sensitive, I'll drop them to a 1 in 10,000, but mostly start with a 1 in 1,000 dilution. And you are taking that antigen under the tongue every day. So it's done in-house, and I brought my little set of goodies to kind of show you what would be involved. We have, where's my camera? It's a little blue stick with tiny points on it. So it's not a needle, but it is sharp plastic. And then I have 10 vials, and on someone's arm, we'll do 5 dots. I'll do a positive control, and that is actually histamine, histriol, in a solution. Put that in, poke it through with that little plastic poker, and then I do P for positive control and then P for pollens. So then it'll be a solution of 5 grass pollens, 2 ragweed pollens, 6 weed pollens, and 10 tree pollens. Poke those into the system. Then a negative control, because all of these pollens are in a solution of glycerin, and if someone reacts to glycerin, then I really cannot use this therapy on them. And then one for cats, dogs, dust mite, and molds. So just going alphabetically on the right. So smallest to largest of the pollens on the left, alphabetically on the right, so it's consistent every time. And then watch and wait and see. I have my little measurer. Oh, which way does the mirror go? I can see exactly how big that hive gets. So we're watching or waiting, taking history, and seeing how big a hive that person develops. And then based on that, write a prescription, send it in, and we'll get some dropper bottles that look like these ones sort of in the background here. And the person takes it every day. Still, we're looking at 3 to 5 years for desensitization, but it's something that is retraining the immune system. We're coming back to that element of prevention and treating the root cause, which is that the immune system is overactive. And we're going to teach that immune system not to be overactive, that cats are not that big a threat. Weeds are not that big a trauma to the system, and they don't need to mount this huge and excessive response. So this is done in-house during an appointment, got all my first aid stuff, but touch wood, have never needed to use the first aid on anyone. It is generally very, very well tolerated. Pros and cons, it's easy to use. You're doing it yourself at home, so that's nice. It does have a great safety profile. There are no cases, last I researched, of anaphylaxis from sublingual immunotherapy. However, in the States, it is still anyone who's on sublingual immunotherapy needs to have an EpiPen. In Canada, that is not a requirement, but I do think it is a good safety practice. Always nice to have, your extreme cases ruled out and have that comfort zone. It's often covered by insurance. So if I can send people on my handout, I've got the drug identification number. They can confirm with their insurance that it's covered at 80% or 100%, whatever it may be. And because this is working in the background to retrain the immune system, if you don't need to worry about cats, you don't need to worry about grass, it's not that big a deal over time, but you're still living life and in the world where you're breathing in pollens and having an allergic response, you can still take antihistamines. So it's nice because you can treat the symptoms up front while long-term slowly retraining the immune system that we can calm down. And then there's no needles. So big advantage for a lot of people. So it's daily. It's going against the immune system in the oral mucosa and just under the tongue, rather than weekly and into the muscles. The downside is it is expensive. So roughly about $100 a month. But if the insurance covers it, then we're golden. And some people are like, yeah, I don't care. I'm spending that much on antihistamines anyway, or not much less than that on antihistamines. If I can get to the point where I no longer need that, great. It does take time. Antihistamine, you take it, you should feel some effect pretty quickly. This one, we're retraining the system, as I said, 3 to 5 years, depending on the number of allergies this person has and their consistency in using it. And no safety profile is perfect. It is still, you're bringing an allergen into the system. So the first dose is taken in-house where I have access to all of my medical equipment, and again, have never needed to use it, and hopefully never will. But still, it has good safety profile. Nothing is ever guaranteed. The 6th principle of naturopathic medicine, that was just my treat the root cause chunk. Doctor is teacher. This is my job. These are your options. How are you experiencing this? What can we work together? And in the same way that I don't know how my car works and I don't need to know how it works, I just need to know how to drive it safely. The mechanic, that's their job. It's my job, I think, to distill the abundance of information on health and bodies into something practical and cohesive that I can then guide my patients with. So it's my job to read all those reports and work with people and get an idea of, okay, this works, this doesn't work, this dosing is better, even though the other patient did better on that dose. So it's playing with that. So I get to learn, and then I get to impart that to my patients. And then prevention. We're looking at allergy prevention. I prescribe HEPA filters a lot. London Drugs, Canadian Tire, Home Depot, Amazon, Walmart, they're everywhere. They are high efficiency particle filters. So they have multiple layers. They come in a range of sizes depending on the square footage that you are trying to filter out. So at the very least, I ask people to put a HEPA filter, people with allergies, I ask them to put a HEPA filter in their bedroom. So figure out the square footage and what size HEPA filter you need for that. And at least filter out the air of particles while you're sleeping. That's when your body is healing, regenerating, letting go of all the stuff of the day, cleaning house, getting ready for the next day. So at least during that third of your life when you're asleep, if we can keep the pollens out and the dust mites gone and any mold spores that are floating around. If you have a pet allergy, ideally you don't have the pet, but I do have a lot of people coming in going, can you test me? I really want to adopt a dog. I'm like, sure, let's test you. Or, how long I need to desensitize because my girlfriend has a cat, also a common one. So we get that HEPA filter in the bedroom, at least while the body is healing. You can, overnight, you can get rid of the particles that are irritating it. Face masks. Wouldn't you know, they've been around for allergy sufferers for like at least a decade. Oh, and I'm going to close that down. But, prior to a year ago, no one wanted to walk around wearing a mask just because there was pollen in the air. That felt a little bit, oogie, and I don't want to be that person in a mask. Now that masks are not only socially acceptable, but mandated, finding one that can help with pollens is a good suggestion as well. So my pretty little homemade one from home, there's gaps, right? Wherever there's holes and gaps on that mask, that's where pollens can get in. You can breathe them in. You're not going to be any step ahead. If you get something a little bit more advanced, like the N95, I don't want this to muffle my voice, but you can pinch it along the nose, get a tighter seal, or get, a proper circular one, or one with respirator vents. This is a good time. This might actually be a really good year for a lot of allergy sufferers because they're going to be wearing a mask anyway, and they can just wear it outdoors as well as indoors. The masks we're wearing now obviously are to prevent respiratory droplets carrying viral particles from spreading out to other people. Viral particles are 0.1 microns in size, teeny, teeny, tiny. So if a mask can filter that out, it certainly should be capable of filtering out pollens, which are 10 microns and up in size. So a face mask might be, the right answer for this year. It just has to be well-fitting so that the pollens can't get in, but the filtration level should be adequate considering the size of pollens. Immune modulation support, so as nutrients, diet, herbs. Who is this person? How are they expressing it? Is it mostly watery eyes? Is it mostly itchy palate? Is it mostly a tight throat? How are they expressing it? And then we fit the right herbs and nutrients to support them. And then sublingual immunotherapy ties into this whole idea of prevention. If we can retrain the immune system, then next year your allergies should be better. 3 years from now, maybe really mild, don't need an antihistamine at all. 5 years from now, ideally should be, no issue at all. So those are our 6 principles of naturopathic medicine as related to allergies. Thank you so much for showing up and your time. My goal was half an hour. That was 28 minutes. I don't know if there are any questions. Let me see. Sometimes there's a chat box. I don't see any questions now. If there are, you can email them in. You can email me at hello@drmirandawiley.com. I can't give medical advice if I don't know you as an established patient, but I'd be happy to answer any sort of general questions. Thank you so much for your time and attention. And appreciate you coming here today. Take care.